everybody.
Good morning.
You'd never know it, but my cat next persistent lately.
I think animals
Check.
Hey, Jim.
Hi.
I have it. I just found it. Sorry.
Bob, are we waiting for anyone else before we start?
No, I think we're good to go, Amber. Thanks.
All right, then I will call to order the August 13th work session of the State College Area School District Board of Directors. And we'll start with a roll call of board members.
Dr. Bader,
here.
Ms. Bedell,
Here.
Ms. Brandt,
Here.
Ms. Concepcion,
Here.
Dr. Duffy,
Here.
Mr. Fazzard,
Here.
Mr. Hutchinson.
Here.
Mr. Leos,
Here.
Ms. Sydney.
Here.
All right, thank you everyone for being here. The purpose of this meeting is to further refine our safety plan and school closure guidelines. And with that, I'll turn it over to Dr. O'Donnell.
Thanks so much, Amber. I think I'll start off, and I'd really like to, take advantage of our time with Maciek on the update. And I think there's three key things. Although there's one item on the agenda, I think there are many tentacles, and board members might have more requests, but we want to focus on the guidelines for decision making and how the Department of Health's new guidelines, which just came out this week. I wish it was early July when we had these for talking with you, but here we are. So we want to take advantage of how that might help us. And the decision that the board is required to make as per the State Department of Education does pertain to both our safety plan and our educational models, which obviously all of that includes the decision-making on whether buildings are open or closed. The specifics we put in the plan would be revised if the board wants to include some version of where we are today. And we would make that change prior to asking you to approve that. I also think it's important to see what you think for Amber, Amy, and me as we craft that agenda for Monday. Do you want separate action items? I know some people want to talk about the 2-week discussion that was introduced on Monday. And would you like a separate action item aside from the safety plan and aside from the state's emergency instructional time summary requirement? So in essence, I just kind of wrapped the three things that I have on my notes for us to work on today in one. And before I turn it over to Maciek, I just want to thank him for helping me. Although, we've been in communication with key leaders at Penn State early March. I mean, they helped us to make an informed decision back then. And, right now our request of them with Maciek's help and Matt Ferrari's help has been, we want to monitor the virus no matter what our status is in our community. So we want real-time data from as many sources as possible to understand our community, and we're willing to share real-time data as well. Both Geisinger and Mount Nittany have committed to sharing with us, and Mount Nittany, as we understand earlier today, their testing process is now reduced to 48 hours, the timeline turnaround. Randy, thanks for doing the homework with Tom Charles on that. Earlier today, I spoke with Zach Moore, and yesterday David Gray, and used some information from Maciek and Matt Ferrari. So I have a meeting on Monday with the head of Penn State's COVID Operation Center to continue, our request for what the epidemiologists need to have real-time monitoring of our community. So it's been a positive discussion with them, and I'm confident, we're going to get what we need for the experts who are graciously helping us out. So regardless of the direction, we take on the decision points, we want to still make sure we're monitoring the community because that's going to help inform you as best we can. So those were the key updates that I noted down. The memo that you have, we did adjust the population because we had too high of a number. We added the Penn State students to that 160 number. It's actually within that, so that brought down some of the numbers, as you can see. So if you didn't look at the one-page memo, Lynn updated it a little bit earlier this morning when we made that correction from what I gave you yesterday. So with that said, Maciek helped us develop those items. We also want to make sure that even if we have cut points or markers, we want to have the flexibility depending on what's happening, because markers don't necessarily take into account spikes. So the context pieces. So Maciek, are you okay giving an overview of, what we drafted for the conversation? Then we could field some questions after you do that.
Sure.
Thank you.
Hi everyone, and I just also want to thank Bob for all the work he's been doing. As Bob mentioned, I mean, it's not only me. I'm on these phone calls. Matt Ferrari's been helping me a lot with what the university's been doing. I'm at Penn State Center for Infectious Disease Dynamics, and there's at least 2 or 3 other faculty that I've called over the last couple months to get advice or best practices on some of these questions. So there's a handful of us that are chipping in. Bob wants me to go over these guidelines that have come from the state, and they have partially been modified by us. Let me just pull these up. And these are guidelines for the types of thresholds that you would need to reach to close a school. So if you have, I'll read these off, but if you have the 1-page memo in front of you, it's those first 3 bullet points, and it's an or for these 3 bullet points. So if any of them reach that level, that's sufficient to close schools, partially because we don't, and that means all, partially because we don't know which schools would be most at risk from these particular thresholds. So the first one, an average of 23 or more new cases per day over a 7-day period. So that's if over the last week there have been a total of 161 new cases. So that's a sign that transmission has been increasing or is high. Currently, we're in the single digits. We get 2, 4, 5, sometimes 0 new cases a day in Center County. The second bullet point is if we reach the 10% threshold. So our 10% of tested cases coming up as positive. Currently, from Geisinger, these numbers are in the 2 to 4% range. These are all cases. They're not right now broken down by age, so we don't really know if it's children or middle-aged individuals or older individuals that are testing. I think Dr. Drass is on this call, so she'll be able to just give us an approximation, at least over the last month, whether it's been older or younger. Joy, is that something that you know, or is that something that Geisinger knows?
I don't have an exact answer to that question for you at this time. I know at least monthly Geisinger looks at the data and the breakdown of pediatric positives. The last data I have for that is from the July meeting, so mostly June data, which is obviously we're trying to get more updated information. There's another meeting next week, so I think they'll be compiling that. By far and away, the percentage is, drastically lower than in adults and the elderly population, and I just don't have that number off the top of my head.
Okay.
I'm working on getting it though.
Thanks. And the third bullet point, so if the Mount Nittany Health Center, if the ICU capacity, the number of beds that are occupied in the intensive care unit, if that reaches 2/3, that's a high level. This is now a time where we would want to be concerned that somebody that's at risk of becoming critically ill, so this might be somebody over 60, we would want to be concerned that as a precaution that the ICU might be full if we let the epidemic continue on its path at that point. So one thing that Bob wanted me to explain was how we're going to view these 3 bullet points and how strictly we're going to adhere to them. There are times when some of these signals raise a bit of a false alarm, and you don't necessarily need to go by the letter of the law. And there are times that these signals aren't quite enough in terms of telling us what we should be worried about, and we may want to close earlier before we get to these signals. So let me just outline 2 examples on both sides where we may want to take a different decision than what's outlined in these bullet points. So one, the false alarm scenario. So with good knowledge from Penn State, from Mount Nittany, from Geisinger, with good inside qualitative information on who's being tested and for what reasons, if we see, for example, 50 or 100 new cases pop up in 4 or 5 days, but all of those cases are from elderly care centers, and they were from individuals who never reported to a hospital. They were tested at the center, and the center has its own hygiene practices. we may now take a decision that the outbreak is taking place only at that elderly care center. And even though the case numbers themselves are high, it doesn't seem to pose a risk to the community, to the school, or to universities, to the university population. Now, of course, we would want to announce all of this, and we would want to ask anybody if they had relatives at the elderly care center that they'd visited. But this is a situation where we may want to open up a discussion about the nature of the positive tests that have come up, and maybe we wouldn't react by closing schools if we're confident about the information from the care center, from the, Geisinger and Mount Nittany, where the tests came from, and a few other things. So that's one example that I wanted to outline. Does anyone have any questions or comments about that type of scenario?
Jim?
Yeah, I did in terms of that sounds really good. When you talk about the average, is that a 7-day moving average? Is that what that first bullet point means?
That's right. That's a 7-day moving average. That's right.
Okay, perfect. Yeah, because I know we started moving to those to report the statistics because people were not checking in on weekends, and then so you sort of have a bump on Mondays, and so they went to a moving average. So that's good. Thank you.
Any other
Laura?
questions? Laurel,
Sorry.
you're on mute.
Sorry. Do you know if the care centers themselves have do areas like that have closing guidelines similar to what we were putting up with? So if there were that type of spike, would they have put into place a closing guideline? Do you know?
I don't know the answer. Joy or Bob, do you guys know?
Laurel, can you say that, your question again? Sorry.
I'm wondering if things like care centers have guidelines themselves, so that, say, our students wouldn't have wound up being able to go in because they would have clamped down with their guidelines even before we found out about it. Is where my thinking is on that.
Most long-term care centers right now are allowing no visitors.
Still, okay.
Still.
Okay, thanks.
Yeah, I
Mike,
know. from-
Would corrections institutes be a similar case to long-term care centers in terms of like data that might come out of a correction center? And the reason I'm wondering is I think one of the nearby school districts has decided to start remotely, and I think it may have been due to outbreaks in a nearby correctional facility.
Yeah, so that's another example where if we know that 120 tests were delivered to Mount Nittany from a correctional facility, we would take that into account and view the moving average. We would try to view the moving average as the cases in the community itself, not the community plus the correctional facility. So some of these adjustments are qualitative and they're hard to plan for. So it's probably something that Joy and Allison and Bob and I will review regularly to make sure we're making the right decision.
Scott, I see your hand up.
Yeah, I just wanted to comment on, I like the fact, and if this has been said before, maybe I just missed it, but I like the consideration that we're taking a quote unquote hotspot view to Center County, just like that's kind of a typical statewide approach and a national approach as well, because the county has so many different population pockets and different triggers that could affect those pockets. So I think that's a really smart move to take that approach. And if it was in there before, I apologize for missing it. If it's an ad, I think it's a great ad.
Thanks for that feedback. I'll give a second example that's in the other direction, but any other questions on this first example? Laurel.
Yeah. This may be less of something at this point, but I've wondered, for instance, a couple of weeks ago when we had a bunch of people here for Arts Fest and they talked about maybe a spike. If someone is here and goes away, they go home to Pittsburgh, say, and they're sick there, at any point, does that attribute back to here? So when we talk about our, 23 cases and all, could it be someone, a whole family, say of 5 people that is somewhere else? Or would that family not get counted even if they got sick here?
You get counted at the facility or in the county where you were tested. So if
okay.
if you test positive in Pittsburgh, but the day before you're in State College, unless their contact tracers are extraordinarily connected into in Pennsylvania's DOH data system, that will never get recorded into Center County. That's a risk. We don't really know how big that risk is.
Okay, thank you.
Jim?
Yeah, just another question about, I believe it was Dr. Drass that mentioned about pediatric positives, or maybe you started it, and the question is, I guess, you know, so for our student population, obviously that's the relevant statistic, but then of course we have to look at our faculty and staff, the professionals that are in school, and what their, you know, the positive test rate is there. Will there be a distinction between those two populations like Scott was talking about, or will we base it solely on maybe pediatric positives?
So part of the value of having Dr. Drass and Dr. Huggins in this group is that we get all the inside qualitative information of who's being tested and what the age groups are, and we can have these discussions regularly. So ideally, this 10% number, ideally these percentages would be broken down by age. And even if they're not formally, maybe Dr. Drass would know, and Joy, maybe you want to take the rest of this question, maybe Dr. Drass would know for that week what it was generally.
Yeah, to answer the question, I think you have to try to factor in both pieces of data. Obviously, you know, we're looking at the risks sort of in the school environment. And so you want to know, when we originally started asking this information, it was two populations, and one's going to be much easier to track than the other. One is if they make the break point 18 and under, those are going to be our school district age kids. I think it was asked, what's the incidence for 18 to 22-year-olds, and those are the college kids coming back. That's not going to be a clean break point. They're going to include young adults together, 18 to 25 or 18 to 30, something along those lines. And I think the point of trying to separate out the data is that the pediatric numbers have been incredibly, incredibly small, only 130 in the Geisinger system last time we looked. Obviously, that's just one piece. There's Mount Nittany testing and those sorts of things, but the incidence in the pediatric population is so much significantly lower. It at least helps us tease out what is the nursing home data or the correctional system facility data from where teachers might actually be interacting with the students.
So if we get a better breakdown of those, of the percent positives by age, even if it's in larger age brackets, we'll use that information to make a better decision.
Thank you.
Dan, did you have a question?
Yeah, I was trying to relate the memo to the guidelines offered by the state. And what I see in the memo is a pretty liberal rate of incidence, and also the positivity rate allows for pretty high rates in relation to the ranges that were provided by the state for moving to remote learning. That table that the state provides in their guidelines would suggest, for example, if we have a positivity rate as low as 5%, let me go back and look at it, or a incidence rate that allows for, give me a moment. Sorry to keep you waiting. An incidence rate per 100,000 as low as 10. Now this of course I think relates to general infection, not specific to the age range of our kids. It can be as low as 10 and still move to full remote. So basically they give us a lot of leeway in terms of our making decisions locally. And the thresholds that are provided in the memo are pretty high in relation to those numbers. But as Maciek is saying, we need to take into account the band of the age range, about whom we're focused in terms of the schools. We have to take that into account as well. So I just want to point that out, that the guidelines that the state offers provide an opportunity for, from the way they describe it, districts to to go to a full remote much earlier in the development of infection in the community than we're suggesting within the memo. But then that gives us freedom to make some qualitative adjustments accordingly. But I just wanted to mention that in comparing the framework that the guidelines that are offered within the memo as compared to what is suggested by the state.
Right. So Dan, I think what you're looking at is, so for that moderate band,
Right.
it's 5 to 10%. And so I guess the question is, does 10% make sense as a cutoff since that's the top of that band?
Yeah, I think
Maybe looking at the middle of the band.
right, exactly. And it's a house up, this is about rate of infection too. If we're watching for changes, right? And if this is all about recognizing the R value, if you will, in this whole process, in terms of the transmission of the disease to others, if we have an incidence rates that are accelerating, we want to get on that earlier rather than later, I would think, for the benefit of the community as well as our own safety. So I'm just saying that those bands provide us an opportunity to basically have the freedom to make some good decisions. Relying, of course, in our the help of our consultants, Maciek and our physicians. So that's all.
So Dan, is your question is related to like looking at spikes, or what is our growth curve, rather
Right.
than simply, well, we've had this number of cases and how that breaks down per 100,000 of the population.
Right. Well,
But the question, I think, for Maciek might be, how do we incorporate what the growth curve is, or a rate of increase in infections?
right. And how do you distinguish between a growth, in a sense, a spike, and what will be an enduring trend?
So this does take us to example number 2, which is the false negative case, when we don't hit the thresholds in the bullet points, but we should close anyway. And Dan's example is exactly the one that we discussed yesterday on a separate call. So 23 cases per day is that threshold. But let's say we're in the 10 to 15 range, and all of a sudden on a Thursday and Friday, we see 45, then 75. Can that happen? Definitely. And if you see a spike like that, maybe you don't want to wait for 5 more days of data to close schools, because if 75 people showed up COVID positive on a Friday, it's probable, it's not guaranteed, but it's probable that Monday and Tuesday and Wednesday next week also won't look good. So should you close early on that Friday and declare school closed next week, or most of next week, and then just sort of watch the situation as it goes forward? I think so. I think that's a very reasonable call. Dan asked, can you look at that trend and separate it from a short blip versus a sustained trend? And the answer is no, you cannot. So this is a judgment call that we'll have to make if we see this big spike occur in a 2 to 3 day period. And here's a suggestion for what we can do in terms of monitoring to see if we've made the right decision. So let's go with this Thursday, Friday blip, and we close on Monday. We close on Monday, and we ask all of our students to talk to their parents, or we ask the parents, we ask them to self-report on symptoms for that whole week. Because if we get large self-reports of symptoms from students, then we know we did the right thing. We know that, in fact, there is infection in the community and we've closed schools for the right reason. And if the symptoms reports are minor or non-existent in the student population, then maybe, I mean, this is a big maybe, but maybe we'd feel comfortable reopening again on the Thursday. So comments, suggestions, additions?
Gretchen, you had your hand up?
Yeah, thanks. I had 2 questions. And one is, do we need to take age range into account? Or, for example, well, and in that one, like, why would we? Because viruses don't care about age. They just come into a community and anyone can get infected. In addition to the fact that staff and teachers are not in that pediatric age range, and we care about them becoming infected as well. And then along the lines of that thinking, that logic, I think somebody had asked, are we going to siphon out the Penn State cases from other community cases? And again, I don't understand the logic of doing that. Though I did understand the logic of nursing, long-term nursing care, because those, as Joy had said, those are pretty locked in tightly. But Penn State students are not. Age range is not. We all live together in this community. Anybody can get it. So I'm kind of wondering what's the logic in that. I'm not understanding that. The second question I have is that since we need to be ahead of the numbers, I'm wondering why we would wait for the numbers to go up, because then we know it's already here. It's so highly contagious that anytime we're waiting for that, then it's already here. It's already too late. Infections are already spreading. So I'm not understanding the logic of waiting for the numbers to spike, and then we know we're already behind the curve, and then trying to do something about it. I thought by this point we had all learned that we need to be ahead of the curve in order to have containment. And so just some, I guess, logic questions that I'm not following. So just some explanation, I guess. Thanks.
Sure. So let's do the age range question first. Why and how would we use age range to help us? So first off, we are going to try to get age-specific data for these numbers, the incidence and the percentages. The reason is that more information is better than less information. So we're generally going to try to do that. But Gretchen's right that we may not always be able to act on this age-specific information. So yes, it's true that if it's an outbreak in a long-term care facility and the age information is consistent with that, we may decide to go through another week of school and just wait to see if the outbreak is a risk to the school. What if the ages of the positives are all in the 18 to 22 range, which we all know it's the Penn State undergraduates. So now this is a question for the board. Because a Penn State undergraduate may be 2 degrees of separation away from a parent or a student at a SCASD school, so to everybody on this call, would we feel comfortable staying open for a week, or do we consider those 2 degrees of separation close enough that we would want to close? So I don't have the answer here, so just opinions from anyone.
Yeah, I should just say real quick that I don't believe 2 degrees of separation is accurate, because many families use Penn State students for babysitting. And so they're in the same home indoors for long periods of time. And that's obviously not 2 degrees of separation. So I just wanted to point that out. Thanks.
Okay. Anyone else?
And some of us have Penn State students that live with us, right, along with our school-age children.
Mm-hmm.
Okay, Amber?
Yeah, I mean, I guess I'd be looking to err on the side of caution. Even, I think the percentage of parents of children in our school district who work at Penn State is well over 50%. So
Okay.
I think most school-age children have a pretty direct connection to campus in that sense.
Okay, so in that case, as a matter of policy, we can consider Penn State undergraduates as immediate contacts, just the way that everybody else in the community is an immediate contact, and treat them the same way. So we can write that in and we can make our decision that way. Gretchen's other question was, sorry, Scott, go ahead.
No, go ahead. Go ahead and answer the other question.
Gretchen's other question was, how do we get ahead of it? Why would we wait for cases to go up? And this, unfortunately, there's no way around this, because if the cases are hovering at some low level, if you're getting 4 to 7 new cases a day and they're not moving in any direction, there's no way to get ahead of that and to know when they're going to go from 4 to 7 to 25 to 45. So there's not an answer to this question. And one day of data may not be enough, but if over 2 days we see a spike, that's a day that I would recommend that we have a board meeting.
So looking at the 7-day moving average, I mean, those make sense to kind of see, like you said, I mean, 1 day up or down doesn't give us all that much information, but when you look at that, more longer term trend, you can see it increasing. And so I guess I guess those are the numbers that you all have been talking about when do we close, when it hits what number? I mean, am I understanding?
Yes. This epidemic has been unpredictable. And the reason it's been unpredictable is that the epidemic itself generates large shifts in society that then feed back to tampen down or accelerate the epidemic. So we haven't been able to use any of our traditional methods of fitting a few data points and projecting forward a week or two. Epidemiologists have not been able to do that over the last 6 months. So a common sense approach of waiting for 2 days of a spike and then assessing it, I think, is the right way to go.
What about the fact that we do know the date that Penn State starts? And we know, I mean, I've asked you this myself before, Macha, that when the student population enters our community, rates will go up. What about the timing of that? Does that give us any information about getting ahead of that curve, since we know, you've predicted that will happen and we know the date they're arriving? Doesn't that help us?
It does. I mean, if somebody could tell us what undergraduates are going to be doing the last week of August and the first week of September, how well they'll be complying, how often they'll be washing their hands and distancing. If somebody had all that information and if that was foreseeable, we could use that information.
Well, we know they'll be living in dorms together.
Well, I mean, so Bob, Amber, Joy, I mean, this is a very conservative approach. It's a very smart approach of priority one is ensuring no infection. And then the downside, of course, is there's no in-person instruction at an early stage. So I'll let you guys comment on this.
Yeah, and I think that it's sort of the conundrum we're in, right? And part of what we need is to be assured that we are going to have really quick turnaround on data to be able to make decisions with really fresh data, so that I think, to me, into being able to make decisions about whether we're willing to take the risk of being open once students are back. We really have to be assured of real-time data within a day or two of testing. Scott, you had your hand up.
Yeah. So the conversation and the memo, and I think even some of Maciek's comments and questions. I don't know whether this already exists or whether the memo and the 3 bullet points are kind of the starting point of this. But this whole conversation really drives home for me that we're going to need a pretty solid decision matrix on this within 2 weeks that basically says, if then else, with only 1 or 2 cells of variability. Because if we have to make a decision, we're going to have to make that quickly, and we're not going to have time for robust debate about whether the statistics are valid or what they mean or things like that. So I think the number of potential decision points that we can afford to have through debate versus through kind of automatic, just a decision tree of if then else, I think is going to be important, because we're going to have to react quickly. We're going to have to react quickly to Gretchen's comment, and Maciek, whether we can get ahead of the curve, but we definitely don't want to fall far behind the curve. So to be able to make those decisions quickly and analyze the data, and not sit around at that point in time with opinions, but just with actual data and a matrix that we've already agreed to. Therefore, it kind of takes so much of the emotion and opinion out of it. I just think that that's going to be vital. So if these 3 data points or these 3 bullets are kind of the start of that, and then we build it out into our decision matrix from there, for me, I think that makes a lot of sense. And and the other thing is, it gives the community a sense for where the direction is, and it lets them know, because they're going to be looking at this and trying to track it as well, because they're going to be trying to get they're going to try to stay ahead of the decision curve as well, because they're the ones, especially the young kids, they're the ones that have the biggest impact. If we, get data on Friday and say we're closing on Monday, and suddenly I've got to find daycare for my, kindergartner with basically no working days notice, that kind of thing. So I just think that would be helpful. Thanks.
Laurel?
Thanks. We heard a while back, Amy gave us the example of the lily pads in the pond, right? That you get that exponential growth and you jump, once you start moving, you move very quickly. If we've had, say, 2 weeks of 2 to 3 cases a day, so no spike, what are the chances that there are sort of tendrils underneath everything, and that we actually will have one of those one-day spikes, even though we're not seeing it in the way we're used to thinking of, okay, we go 2, 4, 8?
So at the beginning of this outbreak back in March and April, when countries had hotspots and they were sort of limited and we were trying to predict where was going to be the next hotspot, they talked about days to case doubling as being one of those measures. So I think we all expected, when we were following these numbers, to see this huge exponential increase. We would go from 5 to 1,000 in a day or two timeline. And it actually is not quite that quick. I think if we're paying close attention to the numbers, the 7-day average and the percent change in that time is really close monitoring, essentially a day by day or week by week basis. And then Maciek's point about, wow, if we see a bigger than expected spike in even a 2-day time period, that's saying, hey, we don't even want to wait the 7. That's, I think, as close and conservative as you can get to trying to monitor the data in real time.
So am I hearing correctly that it might well be possible within a community to have that sort of very low level steady state infection that we learn to live with, at least until we have a vaccine, that we may well have 3 or 4 or whatever a day for very long periods of time without ever getting to that jump? Is that what I'm hearing you say?
That's the hope, with all of the mitigation
Okay.
measures in place.
Yeah.
That's absolutely the hope.
It won't go to 0, but it will be very low and steady.
Correct.
We'd hope it goes to 0, but yeah. Okay.
But we're about to make some big changes in human behavior that are going to affect the existing equilibrium.
Right. No, I get that. I just wanted to have a sense of how the epidemiology works.
Bob?
Yeah, I'm on. I just wanted to speak to a couple points, including the decision making. So the plan as it's written thus far includes flexibility for decision making with the administrative team, with safety team folks, especially Maciek, and that's how we wrote it. If we shift to put markers in, like the discussion now, and transition some variation of what the Department of Health gave us from the state, we're still suggesting to have flexibility. The key question would be whether the board wants to make that real-time decision, or if you'd like us to make it. Obviously, I defer to Eder on, if we can have emergency voting meetings. Obviously, we couldn't advertise them and follow what constraints are, but I'd look to him if the board wants to now have that decision-making. There's no question, in the spring, our administrative team and myself, we made the decision before most anyone else. And, but the board would have to trust what we would be doing. There's not a science that we can spell every decision point out, because we don't know all the data points and where they're coming from. So if we would deviate from the markers, we'd obviously have to share our reasoning with the community, because that's a big pivot transition that if it's not spelled out. So I share that with the board, because to develop all the decision, algorithms right now, or decision points, I don't think we can do all that in a couple days before you have to take action on Monday. But we can keep working on it. So, and I'll go either way. If you want to have emergency board meetings to take action, we'll do it. Thus far, the plan has not been written that way. If we do these markers, I really believe we need to have the flexibility for people like Maciek to weigh in on changes that happen, so that we have typically erred in the side of caution.
I'll add to Bob that Scott brought this question up on the decision matrix, and it's true, it's hard to put together quickly. But the other thing, and this is from experience, that when you put together a decision matrix like this, it's still very likely that the data point that comes in front of you is outside the decision matrix, and you again have to make a qualitative judgment. That's really common. I had one other comment, but Bob, you were in the middle of something.
No, that's it.
So Scott also mentioned, it's better if we have this decision matrix, because then we won't put parents in this position where they may have to find daycare or stay home from work tomorrow if the closing doesn't happen immediately. But I think no matter how we put these decision matrices together, no matter what criteria we use, there are going to be likely situations where all of a sudden we need to close in a day. I think that's to be expected. What are other people's thoughts about how serious this is and how it should be communicated?
Hey,
It's a global pandemic.
I'm sorry, Amber, if I could, just because it was my comment on the decision tree, I really wasn't referring to it being a board decision tree or a non-board decision tree or whatever, just, making sure that as a group, we know and are comfortable. I mean, I'm completely comfortable with the administration making the decision, the safety team, the supporting, experts, et cetera, just so that we're kind of all on the same page with what that expectation is. And certainly fully recognize we can't predict if something's going to happen next day, but if we can minimize the potential for that, that just gives people comfort. So yeah, I know we can't predict any of this, just trying to find ways to, for the community to be able to sit there and say, okay, yeah, I know there's still some uncertainty, but we've mitigated as much of it as we possibly can, and I'm on board.
Lori, you had your hand up for a while.
Yeah, thank you. Because it seems impossible to be ahead of the curve, which would really be the most ideal situation that we have, I have two concerns. First is that we as a district might very well be contributing to the spike and putting our community more into the weeds than we would otherwise. But the other point too is, and this goes to the point about closing and Scott's point about daycare and all that stuff, the possibility that we could be on a giant yo-yo of opening and closing seems incredibly disruptive to effective pedagogy and helping our families plan for things. And I wonder if there's a way to address this problem by saying that when we do have to suddenly close, we will definitely close for X amount of time so that faculty can move to whatever, remote plan that they can have in place. Families can get themselves situated for a period of time. I just think that the jerking back and forth is going to be super disruptive to kids' ability to, particularly kids who have trouble if they're not in a routine. So this is a huge red flag for me. And I think the last point I'll make right now is that the testing turnaround is really good right now. We're learning from Geisinger and Mount Nittany Medical Center, but I think those typically come from referrals. And I think I'm really concerned about people who are just like, nah, I don't know if I feel so good. And they just decide to cart themselves over to the Quest place at Walmart or to MedExpress. And the turnaround time, I talked to MedExpress this morning, the turnaround time they told me was 3 to 10 days. And Walmart's Quest is up to 2 weeks, maybe a week, if you're lucky, is what they literally told me. So I'm just worried that there's no way for us to effectively react And that by the time we do, it might be too late. And when we do, we're going to put people on a giant yo-yo. That's all. Thank you.
Can I
Well-
speak to the test for just a minute? The yo-yo is much more complicated. But the testing piece is pretty easy because if you feel sick enough to get a test, you should be considered a presumed positive until your test result comes back. And those people should be quarantining at home or isolating. I don't know how you consider one might check if they're quarantine or isolation if you're waiting for results. But those people should stay out of the environment until they meet the positive case criteria, which is 10 days, 24 to 72 hours fever-free, improving symptoms, or proof of a negative test. I mean, if you are sick enough to be tested, you should assume you're positive until your test result comes back. So those people should be taken out of the exposure mix at that point. The contact tracing piece is much more complicated.
I apologize for interrupting, but there's been reports of those individuals not doing that. So I think it was the case of the assistant football coach in New Jersey, went to practice with the team while pending the results. And so now they're all in isolation. So I agree with you, Dr. Drass. It's absolutely, that's the way it's supposed to work. But again, that's like we've talked about mitigation, that's relying on individual responsibility behavior, which isn't always 100%. So we hope it's majority, but it's a challenge. I'm just recognizing it's a challenge.
Yes, I agree. It's a challenge. I think continual reinforcement and continual teaching. I mean, I have had the quarantine discussion with so many families on the phone with so many complaints that, it's absolutely continual reinforcement. And is it perfect? No. Is it, I don't know, do we try to give people a chance? I don't know the answer to that. I hate to sacrifice all of our kids' education for not given a chance.
Joy, do you think, even casually, do you think there would be a way to report this many % positive, this many % awaiting results, and then and that could give us a little bit of a picture of the people that have come in for testing, but we still don't have their results?
Early on, that was easy because the data was such a short-term collection. Now, as I see total tested and total positive and total negative, we have so many months now of looking at the data that it's hard to pull out that number of tests that are pending, especially from the 3 different data sources we're trying to pull test statistics from.
And at Geisinger in the labs, there's not a casual way they could be recorded day by day, just this many taken today, and we'll probably have them in 3 days.
I mean, if it was a single site, that's pretty easy. I could walk down the hall to my lab friend and get that data, but they've got multiple clinics and facilities over the whole state, so it's a little bit harder to do. From the student perspective, if you send it, we talked about this a little bit in the health plan, if you send a patient home for symptoms, you can say you either have to have a note from your physician or a negative test. And we're going to say, we are not writing you a note to clear until you have a negative test. Or if you don't want to test, we presume you're positive and give that 10-day criteria. The kids who don't come in the first place are the ones that are harder to capture. If they stay home with an illness, I don't know if you can institute a plan with every kid who has an absence needing a note. That's certainly going to overwhelm our offices a little bit, but again, it's still a better way to track than not having any sort of measure or metric. From the staff, can you as a school require them to provide negative test results or stay out until they have test results? I don't know if you feel like you have more control over that. All of this gets tricky because it's protected health information. But when you're trying to get clearance to return after an illness, I think we could require people to provide that data or a doctor's note.
So, Yeah, just so the two summary points here. If the test turnaround time is slow, yes, we're working in a very information poor environment. And ideally, if we had at least some information on the number of people showing up to get tests, that would be helpful. We don't know if we'll have that. And then if there's maybe keeping track of absenteeism, as Dr. Drass just suggested, if this is possible, easy, if a direct count of daily absenteeism in the schools is available, that's more information. I mean, you guys would know if the absentee patterns are typical or high, and that could give us a little insight as to which way the decision should lean. I have a yo-yo comment as well, but maybe on these absenteeism. Any thoughts on the absenteeism issue that Dr. Drass brought up?
Bob, that's something we put in the PIM system every day, right?
As far as just monitoring those numbers.
Yeah.
That's one of the variables we have in the current plan, because one of our challenges is if, we have a lot of people quarantining, and we're in buildings, we're going to end up having a real problem quickly with supervising students. So that's why in the current plan, we've asked for the ability to close buildings if we run into that problem.
We can track daily attendance into years past. It would just be a full-time job to make those phone calls to find out if the symptoms align with COVID-like symptoms. In addition to staff, we could have up to 100 staff absent on any day. That might make that a little bit laborious to process.
Okay, but without the symptoms, so that we don't need to call everybody, just the daily absentee numbers, I think, in comparing to last year would be very helpful. Lori brought up this yo-yo problem of reopening and reclosing. This is a real problem. This is a very, very realistic scenario that that the incidence goes up in a bump and comes back down, and then goes back up a week later, and then there's a 2-week period with high incidence and then a crash. This has happened in many places routinely since March. So this is a real problem. And this is for the educators. I don't have an answer here.
Yeah, I think we'd want to, if we do get in on the front end of the year and say we're out, I think we'd want to have a certain time period where we're below a marker before we return, but then also look at the experience. Obviously right now our planning and thinking is if we can be in school safely, we think that's valuable. And we saw why online learning is really difficult for K-12. And although it's a little different at each of the levels, it's not easy. And, this week I've been interviewing the students that I do annually, and a bunch of them came over yesterday. Obviously we were outside, but to see somebody in person and to be able to have that conversation versus in front of a computer is really different. And the energy level from the kids was pretty impressive, markedly different than Zoom meetings. Again, it has to be safe if we can get in. I do think the ability to know a kid's out of bed or a kid's actually in front of you is just so much different than, when we're sitting in Zoom or the kids don't even log on. So if we can be in safely, I think, obviously we would want to read how it would go early on and obviously listen to the teachers and the experience and the challenges and how it's going to weigh in on whether the transitions back are most valuable. Obviously our parents know their kids the best, and almost 3/4 of them think it would be best for their kids to be in school. Obviously I'm sure they also believe the same as we do if it could be safe.
I'm looking at these comments and I feel like we're spiraling a little bit into what if this and what if that, and people won't do what we tell them and that sort of thing. And the safety plan has layer after layer after layer of mitigation strategies because we know not any single one will be perfect. That's why it's not just masking. That's why it's not just physical distancing. That's why it's not just hand washing. That's why it's not just cleaning rooms and facilities and that sort of thing. Is human behavior perfect? Absolutely not. But is it automatically a catastrophe? I don't think that's the case either. And it just feels like we're sort of giving up on the students before we even give it a try.
Dan?
Yeah, I guess, and I really appreciate Joy's point too. We can what if this to death. You know, we can look at every possible eventuality, every possible limitation and divergence of reality from what we encounter from what we're planning. Going back to Bob's question earlier, these are the two elements to whatever we communicate to our families and to the community. That seem important to me. One is that we provide a range within of the data we're concerned about in terms of, because people can cross-reference back to the state's website to see how close we're getting to those thresholds. I feel better, it would give more freedom to the team, to the safety team, to have a range for positivity rates and incidence rates. And along with that would be an explanation about what are the considerations that are going to come into play. Are mostly the elderly affected, or are there other members of the community, and so on. Having an opportunity for people to see the kinds of the parameters around which we'll be looking at the data. But having a range for things similar to the way in which the state set it up in terms of their guidelines. Again, not the same numbers, but the same idea. The other thing that comes to mind is I would feel better. I don't think the board, 9 of us, given how diverse we are, that we would have the capacity to come to necessarily one mind about the decision on the spur of a moment, in the spur of a moment. I would be inclined to want to, in our decision this week, agree as collectively that we are willing to defer to the administration with the safety team making decisions regarding closing. And I really do feel that that's, as we often describe ourselves, we can sometimes get into the weeds on this, and we don't have near the training and experience with this stuff that Joy does and Maciek does, and certainly Bob has the primary responsibility for this. I'd be willing to defer. I'll suggest as one of mine that we have an approach to this through which we defer to the safety team on these decisions.
Jim?
Yeah, Dr. O'Donnell, I'm glad you said something because I assumed it was your operational decision, closing of the school district and/or individual schools is your decision. Informed obviously by what the board decides on the health policy and what our experts suggest and the safety team comes up with. The other piece of information, and I'm not speaking as a Penn State employee now, rather a Penn State parent. I think somebody said we know when the students are arriving, so it's spread out this year, and they start arriving on the 17th, which is Monday, and they make an appointment for arrival. It's at the Bryce Jordan Center, and their first year students are going to go from Monday to Thursday, and then the returning students are going to start. So we don't have a traditional arrival weekend this year that we normally have. So it's going to be spread out, and maybe that's better for getting some baseline data. Maybe it's not, but it's definitely not a definitive time when students are going to arrive this year.
Amy?
Thanks. So I want to backtrack for a second. I don't think anyone is trying to shortchange the community and opportunity for kids to have an in-person experience. At least I'm not interested in that. But on the same token, I am not going to ignore the reality in our country and including in our region that the human behavior and the compliance with mitigation efforts is not comparable to other places who have opened schools. And that's just factual. We've already seen it play out in Georgia. Iowa, a variety of other places. You know, when we look at the US's comparative rates of growth compared to other countries, we're not doing as well. That's scientific fact. So we have to take that into account. So that's not about cheating kids. That's about what the reality is of the circumstances we're living in. And Matcha can maybe speak to that as that's relevant. So I'm not going to ignore that fact in my decision making. However, I still want kids to go into buildings, you know, if we can do it safely. So I'm supportive of that. I know how important that is. It's why I signed my kids up for in-person. So there's that piece. So I just want to be clear. It's not an all or nothing. It is that the situation in our community and in our state is that we do not have the same levels of compliance at mitigation efforts by the community, period. The other point I just wanted to throw out as we talk about real-time data. So I'm encouraged to hear that we're hearing from Mount Nittany Medical Center that they have some higher turnaround. I just, and this doesn't have to be answered immediately, but I would just like clarification, is that Mount Nittany Medical Center, the hospital, like the patients coming into the ER, or is that Mount Nittany Physician Group? Because I believe they process testing, I would suspect, differently. You know, Mount Nittany Physician Group, I don't know if they're using Quest, and the governor has indicated that because Pennsylvania is doing better than a lot of other states, a lot of our testing is getting lower priority because Quest is a big corporation and processing samples from all over. So I would just like better definement of that. Are we talking about, because we know that the sickest patients are going to be going through the ER, so that's not going to reflect the community level necessarily, because we know we'll have more mild cases that are not going to the ER that'll be tested at other facilities. And if they're going to Walmart or MedExpress, where we're looking at 1 to 2 weeks out, that's a concern. So I'm a little bit concerned about our ability to surveil lower symptomatic patients because of where they may go for testing. So I think I'm happy to hear, compared to 2 days ago, we think more places are testing more quickly. That's great. It makes me feel a lot more confident about our decision tree. But I just think we've got to keep these other layers in mind as well as to who's going where, right? Because the sickest patients, that's helpful, but that doesn't help us get ahead of the curve. We need to kind of know what the mild, moderate, and the sickest patients are. The third thing I wanted to say, it's squeaking out of my head.
Amy,
The other thing I wanted to bring up, at least to the medical staff and the team, like in regards to what kinds of tests we're talking about, I think that's something that we also have to keep track of. There's an antigen test, which is the rapid test that's used like for surgical patients. It's also the one Governor DeWine had several days ago, and that has a less specificity and sensitivity. So it has rates of both false positives and false negatives. And the governor, again, announced just the other day that a company in Pennsylvania is going to ramp up production of those tests, and they're hoping to get that out to more providers, which is great to have more testing, but we also have to keep in mind that it's less reliable testing than PCR testing, and PCR testing takes longer. And I don't know what that balance is going to shift to in the next coming months. So right now it may not be relevant, but 2 months from now, if a full third of testing is antigen testing, then that may or may not, and Maciek, maybe you can speak to that better about how we look at the data. So I don't know the answer to that question. It was just a little red flag that came up in my mind the other day when that came up. And I think those are the 3 things I wanted to mention in terms of the decision-making tree and where I, as a single board member, feel. I'm happy to have some parameters in place so the community can better understand our thought process and feel safe. I think that's really, really important, but I also think it's extremely important to defer to experts who can look at those subtle nuances and give us good advice. So I want to preserve whatever flexibility they feel like that they need to make safe decisions. And I personally fully support handing that authority off to administration and those experts, but we'll go along with whatever the consensus is. Thanks.
Bob.
Yeah, I just, Amy, those were helpful because I think one of the things why we're trying to get all the information, obviously, to inform everyone and really understand what's happening in the community with this virus. We'll track down answers. So I think it's important for all of us to understand what we're getting from Mount Nittany. I did talk to Dr. John Adams, who's going to participate with us with our employee town hall tonight, but he's with Penn State Health, and they're using Mount Nittany for testing. So we can ask to see if that data, if those results could be included, so that that practice, which is a family practice in our community, can be included in what Mount Nittany is sharing with us in Machek. And then the types of tests, I'll ask, I saw Amber typed in there, would Penn State be willing to share the screening information that they have, the pre-testing, which I believe it's the saliva swab. So, that would be helpful because they sent out 24,000 tests to students that they have to submit before they come back. But it'd be helpful to see if we can get that. So I'll make that ask, and I'll talk to Machek, and he can weigh in now of what he thinks about your remarks, Amy, and that's all I had at this point. Thanks.
Sure. So just going in reverse order, I don't know when and where some of the less sensitive tests are going to start being used, but if they are, I mean. Joy, we would find out from Geisinger if there was a switch made from a PCR-based test to an antigen test for expediency. That would be available to us, right?
Absolutely. Most of the rapid tests right now are used in very specific cases, usually in the hospital, at least around here right now. So the question about Mount Nittany, the hospital has a small amount of faster testing capacity for in-house, but it's a supply issue. So all of their testing through all of their clinics, so Mount Nittany Physician Group, are done at the testing tents. And that, I believe, is what's referenced in the change in turnaround time to a lab that can get them 48 hours instead of the prolonged testing of the past. I doubt we'll change to a rapid test anytime soon, just because of the difference in accuracy for at least the routine outpatient basis. It's really used in the inpatient setting where you need to know an answer and you need to know quickly in terms of isolation and that sort of thing. And the other comment I'll make is that any off-site just test centers, now this doesn't include MedExpress because it would be a clinical care facility, but Walmart and Quest will not test patients under 18 years of age. So the outside testing from those sort of sites really is very teacher specific in the school district, not for the kids.
Well, I guess I guess I apologize for shifting a little bit, but based on Dr. Dress's comment, I mean, I want to be careful about this segregating age groups. I appreciate your point and that we wouldn't know about pediatric data, but I think really when we're looking at number of cases, aside from some of the unique circumstances we mentioned, we're trying to gauge community spread.
No, I totally hear you. My point was just that you won't have kids looming potentially coming to school without that result as quickly.
So I'll just make a couple general final comments on the tests. I'm not concerned about a switch to lower sensitivity tests. So as an epidemiologist, I'd rather have faster turnaround and lower sensitivity. So we know, like in every epidemiology textbook, they teach you how to correct for the specificity and sensitivity of a diagnostic test like this. So we'll still be able to make use of the numbers, but I'd rather have the information a day late than have it be perfect than have it be 5 days late, because then it's essentially useless. You've gone through a whole round of infection and you've gotten it 5 days late. Mild, moderate cases. I mean, our current plan is to have data streams from Geisinger, Mount Nittany, and Penn State with percent positives. And Dr. Drass, are these going to include the Mount Nittany emergency room tests, or are they going to only include outpatient Mount Nittany tests?
I don't have that answer to you. I don't know who you talked to at Mount Nittany about getting their data.
Just Allison.
Yeah, I guess I don't know the answer to that for sure.
Yeah. So I don't know how we'd interpret this differently if we knew the severity of some of these cases. I think we'll put this on our list to evaluate how we'll use this information. I think that's everything. There were a few questions in the last 10 minutes, but if there's anything else, just let me know. And Jean and Bob, I have to go in a couple of minutes. Is there anything else that you wanted me to touch on before I left?
No, I think the one thing that I spoke with Amber a little bit about, because the 10% cut point from the state, when we talk about the markers, I mean, we've talked a lot about the flexibility piece and the why that makes sense because of the changing context, because markers don't take into account the rapid rate of change. And I think that came across. Would we want to consider, rather than a 10% cut, maybe partially through the moderate, have a buildings closed and then have support centers? That's a question for the board. What do you think about the 10% rate of positive tests and that number? We just used what the state gave us. The moderate one also has remote in there. They don't say, they put two different modes in there, and but they don't have a cut for those modes or a recommendation for that.
Yeah. I mean, we could go 7.5%, which is in the range. And this is a very qualitative decision. I mean, we're essentially saying we'll be more conservative in terms of preventing outbreaks, and we're willing to forego more education, which is the downside.
Right.
There's no special, other than that, there's no special difference between the 10 and the 7.5%.
Okay.
I would be more comfortable with the 7.5 just because it's in the middle of that range. If you have time for one question on test, Maciek, I had a question, and in case you know the answer to this, do we know where most Penn State students will be tested if they are symptomatic? Would they go to University Health Services, or do we think they might go anywhere in town?
Matt will know that. Bob, you've probably talked to him.
Yeah, I understand there's going to be 4 testing sites on campus, but I'll get that answer for you, Amber. If I get
their turnaround time, as soon as we can know what their turnaround time is, it would be helpful just to know the turnaround time for them.
Yeah.
Can I add one quick comment before I have to go? Which is, I do just want to reiterate, I in no way, shape, or form want to or mean to discount the teachers' health in all of this. Keeping them safe is absolutely probably more important because they're at higher risk of a more severe disease. I just can't speak to that as much because I'm more knowledgeable about the pediatric population. So I don't want it to come across as if I don't think that the teacher's health is important. I just don't know as much about the specifics there. And I also want to say, I really appreciate the time and thoughtfulness. This is a scenario with no great answers. And it puts us all in a really tough predicament. And the conversations and trying to consider all aspects is really important to be as prepared as possible. I haven't slept a full night since March 13th because we don't have good answers and a good way to predict. And I suspect most of you are in that same situation. So anyway, thanks for allowing me to participate. I have to go now.
Thank you, Joy.
Joy, thanks, Maciek.
Thanks, Maciek.
Yeah, thanks, guys. I fully agree with Joy's point on the teachers. I think this merits a discussion. I think it's really important. So I also have to go, but if we can revisit this, I'd be happy to join.
Thanks.
Thanks.
Laurel, you had a question?
Yes, thank you. I was just writing to myself. One of the questions I've had before was what percentage of our teachers have students in our schools? And I don't know if Linda knows that or if we can get that. I'm just curious, sort of as a way to gauge that little piece of things. So the couple of things I'd wanted to comment on, one is the who makes the decision, and I agree that we can't have an emergency board meeting every time and there comes a point where having 9 people versus 3 people, I would like to leave it with, Bob makes our snow day calls. We all have been accosted by people. I assume others have as well been accosted by people who don't like whatever call he makes, and we back him up. He does the best he can with the data and has the best interests of everyone in mind. I would certainly appreciate that as soon as a call is made, the board be notified as soon as possible, because people will wind up coming to us just to happen to know us. And I would like it probably, if possible, if at least Amber and or Amy could be involved as board leadership, because then they can also be people we can ask questions to instead of inundated if we have them. But I really think it can't be a whole board emergency session every time. So that's my input on that one. And snow days, we've gotten very used to them, but there are life and death consequences with them. They're different than these, but not only do we trust Bob, but we back him up, because if, heaven forbid, a wrong call gets made, that's a huge amount of responsibility that we delegate, and we have to trust and back up the person we've delegated it to. I think that's why we've all felt comfortable with that delegation in the past, and looking ahead. The other thing I wanted to address is that this goes back to a while back when Lori talked about, I think it was Lori, about the jumping back and forth. We'll be in session, we'll be out session day by day, and that just not knowing. And I remember, I think it was Dr. Druss talking about the impact of not having the routine on children. I think that's a real concern, and of course on parents. And this may not be the place, I'm just going to put this here, we can come back to it later, but where my thinking is I think several of you have heard me talk about the idea of actually having all remote learning. So everyone's doing that, but then having a way that kids can, when it's safe or safer, be in school to do their remote learning. But to me, part of what appeals about that is the idea that it wouldn't be quite as much jumping back and forth, and that depending on how the in-school option was set up, it might be actually safer. We haven't talked about that, so I don't know whether it would be further apart or nearer together or whatever, but I do think it might be different than what we've talked about with regular in-person learning. So that's part of why I had been toying with that concept of having one learning platform, that being remote, but having it possibly having students being able to do it in a supervised in-school setting. And I know we'll come back to those type of ed model things, but this pertained to the piece of our decision-making that is medically, do we want to keep jumping back and forth, or do we? Another thing might be to say that if we go out, it will always be for at least a week, say. So.
Bob, did you want to respond to that, or should I move on to another?
Yeah, I want to let board members weigh in and just see where y'all are. If you want specific responses, we can.
Okay. Dan?
This maybe if you want to give others an opportunity to respond to Laurel. I don't have anything in particular to say, other than in an ideal world, I would love for families to have an option for their kids to participate in the remote if they can't be at home. But I don't know if anybody else has any responses to Laurel's suggestion.
Anyone? I mean, I appreciate that idea of consistency for kids. I think what Lori said about the yo-yoing back and forth would be really disruptive for families in terms of planning. I would think that if we were in a position where we needed to close the entire district, that I would think we would really be waiting for a significant change in circumstances regarding the pandemic and the course of the pandemic to reopen, rather than to take an approach where we're in and out, depending on swings in data. Because I don't see how we get out of, there's no way out of the pandemic except by we have to stop giving it routes to travel. And if we continue to have a significant community spread, even at a low level, and we find that we're not able to stop that when we have schools open, I don't know why we would go in and out. I guess I would be concerned that from teachers' perspective, they need to have some predictability in how to plan their lessons and their instructional approach. So my sense would be if we found that we needed to close the whole district, that would potentially have been evidence that our mitigation measures are not enough for this virus.
And meaning the mitigation within the system, the mitigation we're using in the schools
or the community as a whole.
And the community as a whole, given the Penn State's ramping up their concern about mitigation. The only thing I guess that I had my hand up about had to do with again, it concerns me to have a hard and fast lower threshold of any sort, but certainly a lower threshold for an indication of the presence of the disease. And even in terms of the positivity rate being the midpoint, 7.5, that's really significantly higher than our present condition, which is a positivity rate of 1.6%. And if you look at all the counties in the state, it's really substantially higher than even the counties that are the most affected by COVID. So I think even 7.5 might be, in a sense, above the range within which we might be considering, particularly if we see students or the faculty affected in some way. But I would want to stick with a range that provides, with which we provide a supporting narrative to how we're going to interpret shifts within that range. And even something at 7.5 is pretty high. So I'm comfortable with maybe going with 5, perhaps. But the point is that we had a range within which we'd be considering both the incidence rates and positivity rates as indicating the presence of spread within the community.
And I think that Michael Osterholm at CIDRAP, his recommendation was 5% as that bar for schools being opened or closed. And 5% does seem to be the number where in states where we have seen massive growth in cases,
right?
When they get over that 5% positivity rate that they start seeing.
Yeah, that seems to have been the threshold that I've read in at least one, if not several articles that have to do with whether you could be confident or not opening schools. So, but 5% I think makes more sense than 7.5 as a lower limit, it's a lower limit for considering closing, I should say.
Gretchen?
Yeah, thanks. I just wanted to say that I support what Amber spoke about on Monday night, with an additional thought to, I think that if I understood correctly, the idea was, open for 1 to 3 weeks and then see what the case numbers do and then potentially go remote. And now after listening to Maciek and sort of piecing this all together, I'm now actually thinking that what would make more sense if you actually wanted to get ahead of the curve would be to, Jim just told us, they're having gradual arrival times for students to arrive on campus and starting on Monday. But of course we know, some families will come over the weekend and which is tomorrow because today's Thursday. And, kind of looking at that when people, when our population is going to increase by that much, by that demographic that historically has not been responsible about social distancing and mask wearing, it seems like, and I wish Maciek were still here because I would ask him, but if we know that they arrive starting kind of Monday is the official date, then wouldn't we want, and we know that epidemiologists, including Maciek, are predicting that the cases will increase in our community as they arrive, then it seems like how we would get ahead of the curve would be to wait and see what that spike is in case numbers after they arrive. We know there's a 2-week incubation period, and so we could see what those numbers do and then use the criteria that we've all been discussing. Dan just said the 5% suggestion, use those criteria, or Bob would use those criteria to make a decision based on the actual numbers after that increase in population occurs. And so instead of being behind the curve where we're waiting for infections to occur within our schools, and we know they're going to happen, as Maciek said, and the New York Times predictor, I look at it every day, and for every 1,000 students, they're predicting in our area 1 to 4 infections on the first day of school. And so rather than just watch those happen, we could wait and then see what the actual numbers are. And then, like I said, based on the agreed upon criteria, make decisions at that point. Since we know that Maciek and other epidemiologists that I've read articles about college towns have said the same thing, have the same prediction, that once you have that influx of student population, the cases will go up. And so, like I said, I support Amber's idea, but after listening to Maciek today, and then talking about trying to get ahead of the curve, I do wonder if this is the way that we could potentially get ahead of the curve and not only prevent the infections in the school district, in our schools, but then also, as someone else mentioned earlier, because we service so many families in our community, to actually help the entire community by taking that approach. So thanks for letting me speak.
First, Amy.
Yeah, I wanted to go back a little bit to Amber's comment about, and the question of yo-yoing, and I think it's reasonable to make the assumption, or to expect that if we have to close the entire district, as Amber said, that chances are the community status for disease spread is significant enough that that's going to be something we probably need to do for some period of time. I'm guessing Maciek would, based on that example he used, though, argue if we had some unusual spike that we were preemptive about, and then found a return, there might, from his perspective, there may be an opportunity to talk about returning. However, based on what we know about exponential growth and other things, I think if we have a significant issue, as Amber said, we're going to need to be closed for some period of time. The flip side and the difficulty, and I know this is something other board members care about, and why we've asked about, to Laurel's question about, could some kids be in buildings for some level of supervision? And we've been placed in this untenable situation by other governing bodies. We are not in a great position to answer this question. As Bob said, if we're not safe to be in schools, then how do we potentially create, how do we decide what's a safe range to bring some kids into schools for supervision? And that's really difficult and really unfair. And we really want to be able to provide families, of lower socioeconomic status, or essential workers' children, teachers' children, other things, a way for them to have supervision. And part of the conundrum is that public education hasn't received the appropriate support from state and federal levels in order for us to address these problems. So I just want to be really clear and state that it's not a lack of desire on any of our part to serve those families. And also, it is a conundrum, as Amber said, and Gretchen just said, we don't want to be in our buildings and contributing to community spread. But the fact of the matter is, when we close, some parents are then going to have to put their children with grandparents, care centers, some of these businesses that are extracurricular businesses have chosen to offer opportunities to essentially babysit people's parents on remote days and other things. And those all increase contacts. So, we're really stuck between a rock and a hard place, because by not having kids in school consistently with the same groups of people, which is our goal, When we close, then they're dispersing, which also may contribute to spread. So us being open or us being closed in both ways can contribute to community spread, and we don't know which is going to be worse. And that's not our fault or our community's fault. That lies on the feet of other higher level government entities, and that's a frustration. So I don't know what the answer is, because it all takes money and nobody's giving us any money.
Scott?
Yeah, Amy, I love your point. I mean, great point. And it's certainly not humorous, but I find myself more and more saying to people who get frustrated, and I sometimes have to say to myself as well, that there's no right, there's no wrong, there's no good, there's no bad, there's no win, there's no lose. It's just varying degrees of suck. And that's pretty much where we are, is, we just are not able to really, we don't have the data. And even if we did have the data, there'd be some other variable that would be, throwing us curveballs or whatever. So I think what you were saying, I mean, all we can do is do the best that we can, ask, be transparent, ask people to be as flexible as they can. I do not want the yo-yo, as Lori was alluding to. Yet, on the other hand, if we close because we see a spike and then we see we were wrong, what's better or worse? Obviously, if you go back and forth on that several times in a short period of time, then you have to question your decision tree and whether that's valid or not. But boy, if you have a spike and you're being conservative and you're trying to preempt it, and then the next week nothing happens and it was just a blip, boy, I want to get those kids back in school as quickly as possible, because that's our goal, is as much face-to-face time with teachers as we can safely manage. So yeah, no right answer. Tough ones.
I think I'd like to address a bit of what both Gretchen and Amy said. I agree fundamentally with Gretchen that we want to stay ahead of the curve. We don't want to put any students or teachers in a position that's risky. On the other hand, we're potentially going to be living with COVID circulating in our community for a long time. We don't know how long. Right now, we have really low case numbers in our community. This may be one of the few windows of opportunities that we do have for some in-person instruction for students. And I'll admit to being very pessimistic about the ability to control infection once Penn State students come back, but knowing that at least at the time we would be beginning school, we have very low community infection among the people who would be going into our schools at that time. What I really need to be assured of is that we're going to have really timely data from Penn State, such that if they begin to experience some spike in infections, that we know that right away. And that was one of the reasons I had suggested the idea of the 2 weeks in and then out. To what Amy said about, many people will need childcare anyways. One advantage of having students in school is that we do have a robust safety plan with the physical distancing and the masking, and trained professionals who are going to be implementing that plan. So it's a bit hard to predict whether, the downside of having students in schools, and particularly looking at elementary students who need supervision at all times throughout the day. There's the downside that our schools are relatively large and you can have, hundreds of students in a school. But then there's also, on the positive side, that we are implementing these procedures that if these students were to disperse to various centers, may not have the same level of safety. And to some extent, it's not our responsibility as school board members to try and take responsibility for what's happening in those other places. But there could be unintended consequences in that sense of if students end up places with less safety measures than what we have within our schools. I guess for me, a lot of this decision making comes back to being sure we're going to have timely data. So, because I think we can, if we know that we're going to be able to see spikes in the community before we get into an exponential growth situation, then we're able to pivot very quickly. Potentially before cases at Penn State begin to infiltrate our system. Anyone else?
I think as we look to Monday and the decision point there, if we do decide on these markers, whichever level, I think who's able to be in the buildings is a key question, because if we're going to have students in the building, we're going to need employees. And if we're going to run certain programs, we're going to need obviously faculty. I do think because that'll upset families if they can't get in. Some people are allowed in and some aren't. That's a tough one. I do think we want to support the students with higher needs. And there's no doubt if we have the capacity, we want to support families that are unable to supervise their children if their job's on the line. I've seen some of the notes you've received from young parents that just aren't able to work remotely. So we're working on some things there, and I think we're going to need to define that, or if we can't get that defined by Monday, then work on it and come back to you. I do think the idea of the yo-yo, we don't know as much right now on how it would go, and there's no question with the in-school model that we have, it is set up, and it's challenging, but it is set up for even the teacher to be able to teach if they're quarantined. So there's some positives to that challenging model. If we do go out and then come in, we wouldn't expect our teachers to have to restructure everything they're working on. There's no question in K-5, especially in those younger grades, managing the safety plan is a big deal. Now, there are a lot of classes with lower numbers, and actually K1 and 2 appear to be lower in school numbers than 3, 4, 5. Although all of them have lower numbers than normal, that's still an issue for them to manage the plan. And we'll know better early on. If we're in the first couple of weeks, we'll know how it's going and see how it's going, and report back on that. I don't want to make a forecast on that. My thought, if you said right now, what do you think we should do on that? I don't think we should do anything less than a week to week. Yo-yoing is, but maybe it needs to be even longer windows that we look at. Because if there's a spike and then we see that it really wasn't sustained and our numbers still stayed well below the marker that you approve, would we hold people out for a long period of time because of that or not?
Something I am really concerned about is if we make the decision to bring all students into school and we do begin to see significant community spread, I don't want us to end up in a situation where we have so much infection in our community or our school community that we're not able to offer an in-school experience to those who most need it. So I feel like there's sort of this interplay between the this need to make sure that we provide in-school experiences that for those who most need it, and this question of should we bring everyone in for in-school, because if bringing everyone in school ends up being a decision that harms our ability to provide an in-school experience for the most vulnerable, that would be an unintended consequence that I think we would be, that would be a concern. So, Lori, I saw your hand up.
I just wondered if we have a sense for what the K through 2 class in school enrollment looks like just on average.
Yeah, we do have the averages.
Per class.
It's 14. If you give me a couple seconds, I can get you.
K, I have it right here. K in-person averages 14. 1 is 12. Well, the real 13.9 in K, 12.5 in 1, and 14.7 in 2. 3 is at 14. 4 is at 15.4, and 5 is just below 15. So those are the in-person averages.
Okay.
The average ratios per teacher are higher than that. 17 kids per K, 20 per 1, 20 per 2, 20 per 3, 22 for 4, and 20 for 5.
Yeah, I'm sorry.
Some of those came about because of in schools like Grays Woods and Ferguson Township, we have a higher rate of in-person desires for families. So we did use some, when we transitioned some teachers into the virtual academy, we did use some substitutes, predictable term substitutes, to help better manage those numbers with those principals. I don't have those off the bat, and Vern's not here. So, but anyways, that plays into, it's different in different schools.
Yeah. I'm just thinking about teachers trying to acclimate little kids to these safety measures and the challenges that they'll have, and wondering if that's a manageable number of kids to, even in just the first week, just to get them practiced in how to sit in their desk and how to walk down a hallway. And I'm just thinking about a first grader, like what does that look like? So if teachers feel that those numbers are really manageable for them, then that's great. I haven't had a first grader in a long time, but I remember them being very antsy. So
there's no doubt the challenge of the remote students, and there's a handful of remote kids. It's obviously not half, but that first week we have to be able to teach the safety plan. So there will, if we're in school, there will be some times where if we're just focusing on the safety plan, we won't need to have the remote students in. And we are working with the tech department to also have some ability to just simply extend our network to outside the building, so that you could also access the network if you're outside doing some learning experiences there as well. I think Deirdre was on the call. I don't see her now. I was going to ask her to weigh in if she had anything, but I don't see her. Sorry about that.
Bob, is there probably some information that you need from the board that would be helpful before Monday in terms of if we have specific feedback for what we expect in regards to some of those cut points? This would probably be a good time to weigh in. If the board is not interested in approving something with, say, a 10% number, it would probably be helpful to know now.
Yeah, I think understanding where you are with what you want to see on the agenda, and obviously we could put different actions on, so we don't necessarily have to have everybody. This isn't a voting meeting. We could poll to see where you are if you're interested in seeing specific action items that might be more explicit for you, on how you behave as a board to give us direction. Yeah, Mayor, that would be really helpful for you, Amy, and me to give Lynn direction on how to construct this.
Yeah. Mm-hmm.
Right now, we have the 10% as a cut. Some of you have spoken about 7.5. Maciek spoke about that. Dan spoke about 5. I think Amber mentioned that as well. So what percent for that marker would you like to see, or do you want to just have somebody, we can leave it blank and someone could make a motion and then you take an action?
Scott?
Do we have, obviously, Maciek and Joy and the admin to the safety team, I assume collaborated on coming up with what ended up being 10%. Well,
I think that came from the state, right?
Yeah, that came right off the stage chart.
But they collaborated on going to the high end of the range.
It was really just Maciek with our admin team on translating that into our county's numbers.
Right.
So you could see what the daily numbers would be, but we left the percent at 10.
Yeah. So my consideration is really, it's a lot of opinion from that standpoint, and I would personally like to go with whatever our experts and our safety committee, considering this conversation that we've had, if they still feel comfortable with that calculation as it was presented in the memo, then for me, I'm comfortable with that expertise and that recommendation. If, however, they think through this conversation that we've had and want to ratchet it down or make it a range or whatever it might be, I'm comfortable with that as well. So I'm really willing to rely a lot on their collective expertise and recommendation on that.
Laurel?
Yeah, I'm not really ready to say now because I know, for instance, we got a big sort of a treasure trove of articles and all to read today. And one recommendation I wanted to make, similar to what we did when we were talking about changing the school hours, and we put a lot of the research papers that many of us were looking at and had found, we put those online so the community could see them. I'd like to ask that we find a place to put those out there for interested community members to see. These are all publicly available documents, but rather than every person who wants them having to find their own, as we read them, and there may be ones that we find particularly influential, or that our health advisors say these are the ones to really look at. So I'd like to see those online. And we had also had a question about, even once we've made the decision, what type of data the community will be able to see about what's happening in our schools that will help them hopefully understand, even once we've picked our cut points, what's actually going on in the buildings. So I guess those are two requests that be added to what's available for people to see in the community.
I can talk to the communications team, but I mean, we're really scrambling to open in the year. And if we want to develop some archive or library, I'm trying to get the communication team to be focusing more. I mean, they're going through hundreds of questions right now as we speak for the town hall. We're trying to get our communications and a site up for parents. So the COVID handbook we're developing. So we're trying to get some other key things for families together. I would, obviously I want to run things through the health and safety team. And right now with the key data points, Monchek's a go-to person on that team. And Joy was upfront about that with her expertise and role. And so we want to make sure we're using certain key members with the decision spot we're in to try to best inform you quickly with the best expertise we have. So I think running whatever articles you have or research you have by the safety team, obviously by Monchek in transmission issues. And I think to pull together a site, I don't think we can do that between now and Monday. I just don't, we're trying to open the school year if we're able to be open.
Gretchen?
Yeah, I just wanted to chime in that I would, if we have to pick a number, I'd pick the 5%, not the 10, not the 7.5. I'd pick the 5. And then secondly, Laurel had written in the chat, about this issue of publicly available data. And I think that's a really high priority for families to be able to know what the COVID cases are for the school that their child attends. And then that's just because it's a safety issue. And so I know that everybody's busy and, but that's going to be a make it or break it for some families. And so to say, oh, we're not going to tell you because we're too busy, I don't think is going to fly.
Yeah, I'm sorry. I didn't speak to that point. Absolutely. And our plan has communication to families for our data. Absolutely. I'm sorry. I didn't hit Laurel's other point. And I know Penn State's going to have a public dashboard. I'll share with you whatever I learn on Monday about that. But yeah, we need to be very upfront. I think the numerator denominator data that Monchek desires from as many sources as possible. And that's kind of what I see my role in trying to help get that to him. We absolutely need to, I'm comfortable sharing that out. The information in our schools for families, absolutely. Parents want to know that and should know it. And as Jean has shared, we will be communicating if we identify any cases in our buildings.
Gretchen, was that all, or did you have more?
Nope, that was it. Thanks, Bob.
Yeah, you bet. Sorry about that.
Laurel?
Yeah, that's something we need to sort of keep in the back of our minds. We talked earlier about data about absenteeism, but there may well be families whose threshold is different. If you've got a very vulnerable person in your household, you may go to absentee at a much lower level that isn't necessarily appropriate for other people. So as we look at absentee rates, which we discussed, that may be worth, and I'm just thinking out loud, I don't know how to do it, but to get some information from parents, even if it said, you know, ask them, say in the note that they send in, to say that this is not because my child is sick, but because of a threshold level, so that we don't mistake one for the other. Again, thinking out loud, but just suddenly occurred to me.
And the one good part about it's obviously a challenging model that we're looking at for the in-school, is that at any point, somebody can keep their kid home, no questions asked, and they're not technically absent. They can participate just as if they were there. Obviously, it's not exactly the same, but.
I think I'm certainly more comfortable with the 5% number, partly because that was the range for hybrid to, like, that the state would expect us to be hybrid to full remote in that 5 to 10% range. And if we want to preserve our ability to provide in-school experiences for those who are most vulnerable, I think we might need to be clear that 5% might need to be our cut point where we go to, and that is a kind of hybrid model, that might be the point where we say, well, we're only going to be able to provide school for the most vulnerable, or students with IEPs and children of essential workers. Whatever those parameters are that we work out, I think we should choose a number at the low end of that range, so that we don't end up losing the opportunity to do that.
I second that wholeheartedly.
For definitions, I would avoid using hybrid model on that. I would say that our buildings are closed except for whatever we define, just because right now, technically by the state's definition, even our elementary model is hybrid because we have less students in our buildings than we would have if fully open, and we have 6 feet distancing. So that's their definition for hybrid. So I would I think you're right, you're correct, just how we word that.
Yeah. And I also think, because we are one of my concerns is that we need to think about our growth curve in this community and what's our trajectory. And so if we are at, I think we're like something like 1.5%, 2% positivity rate now, if we reached a 5% positivity rate, that's significant growth in this community. Okay. So and then another question is, what kind of motions, if there's motions that board members would like to see on the agenda for Monday, other than approving the instructional time document and the potential, well, we know that Jean has brought us some adjustments to the health and safety plan. If there's other permutations that anyone would like to see on the agenda, it would be helpful to know now, or, I mean, certainly people can make motions at the table as well. Dan?
Yeah, I agree when I really have to walk it back to figure out where this came up, but I think that we could be more explicit within the memo about the concerns about the effect of the disease on staff, on faculty, and break that out as a separate decision point, separate from the occurrence among students, which of course is also if not even a higher priority, certainly at least an equal priority. But I think that we need to include in the memo some reference to the point that we're going to be considering the involvement of those who are adults and assessing the impact on them in our decision making about continuing school.
Dan, can you expound upon that? I'm not. What do you?
Well, earlier there was a discussion, and I think Maciek might have brought it up. I really don't recall, but it was about the fact that in sharing with the community what our decision rules would be, one of the and it's referred in the memo. It occurs in the memo. It's a separate line item that refers to students, refers to staff, faculty, and so on. But I just would want to be sure that in terms of what we what we communicate to others, that we don't fold them all together. That by that I mean, yeah, we may have low incidence rates among students, but if we have higher incidence rates among faculty, that doesn't just impact availability of substitutes, but talks about the percentage of staff and faculty who are directly affected by they're having diagnosed with the disease or having to be quarantined in some way, that we recognize that as one of the markers. That's one of the measuring points that we're going to have for deciding whether to continue school or to move into a remote model. That's all.
Yeah, you know, Dan, as we look at those two bottom points here that do include us, you know, one of the things we didn't really detail out there that really would concern me is if, you know, Jean gives me a call and says, we did contact tracing and we found 2 or 3 transmissions that we believe occurred in school. That's much more concerning than 2 or 3 cases that we identified came into school. Do you know what I mean? So,
yeah,
you know,
and I don't want to second guess that kind of thinking, Bob. I apologize if I sound like I'm
it's important, because that's a big difference in having a case versus saying that it's likely contracted in our building.
Right.
So,
and it's about just reassuring to the community and also to the staff that we have their backs, if you will. So, and I'm not sure exactly how to word it and what the threshold would be for that, but I think that would indicate that they as well as the students are in a sense a focus for scrutiny and all this, but you know, to some extent related to the fact that sometimes the kids and even the secondary students are not, kids meaning elementary, the secondary students may not be as likely to evidence signs of infection where the adults would, you know, adult staff would be. So anyway, I just wanted to see if there's a way to bring that forward in terms of our attention to the needs of our faculty and staff and in this department. That's it.
Gretchen?
Yeah, I mean, since you, Amber, asked, you know, the question that you did about, do we want to see anything, you know, on the agenda? I mean, I would like to see something to the effect of what you mentioned on Monday night. Mm-hmm. And clearly, if I'm the only one, then it should not go on the agenda. But speaking as one, if anybody wanted to chime in, think that makes a lot of sense to give some guidance that we know the numbers are going to go up in a couple weeks, and to give the students and the teachers a chance to build community and get to know one another. And then once those numbers go up, to be safe, to keep people safe and go remote. So like I said, I would like to see that as a vote, and in respect to teachers, in respect to the community, and out of respect to the health of all the people who live in our community.
Would anybody else like to see that? Would you 2 to 3 weeks, or what was the range that you would suggest, Gretchen?
In conversations that I've had, 1 to 3 has been a 3-week range. Mm-hmm. But again, I mean, I'm putting this out there because Amber had mentioned it. My thinking I already told you all about, but I saw no support for that. So to get ahead of the curve, I saw no support for that. So perhaps there's support for this idea to, once we see those numbers go up, to go remote.
So Gretchen, to be clear, are you suggesting that the action item would say something to the effect of, we will be in school for 2 weeks and then take a break to see what the numbers, so that we can track the numbers for a period of time?
If anybody would support that, then yes. If it would be worded differently and somebody would support it, then I'd be open to that.
Lori, I saw your hand up.
Yeah, I mean, the idea of ensuring that we understand what the data are once the Penn State students come back, it seems to me to be a really valuable point to have. before things can potentially get out of hand. So I would be supportive of that. I also don't mind the 5% marker. So I'm, depending on where people go, I'm okay with both of those things, but I found great validity in that argument about the 2-week stop point.
Jim?
Thanks. I don't know how different, given this criterion, I don't know how different a proposal to, open for 2 or 3 weeks and then decide is from what we're already going to do, right? So if we open, for our hybrid model as Bob says, the Department of Education calls it, and we find out in 2 weeks that, there's some violation of our criterion for this hybrid model and need to go all remote. I mean, that's the same thing from saying that we're going to go 2 weeks and then decide.
If I could just clarify, because I think
Yeah.
I'm the one who had brought up the idea.
Yeah, thanks.
My concern was, if we're not sure we're going to have timely data and testing turnaround, that we could be 2 weeks into school, and because there's a 2-week incubation period with this virus, and because we're seeing, sometimes 7 to even 10 days in terms of testing turnaround, that we could be 2 weeks into school and have infections already spreading in the community invisibly, because especially if we're a week behind on testing. And so the reason I had suggested considering doing 2 weeks in school and taking a break to have some remote instruction was that during that was because we may not have the information we need 2 weeks in to know the extent of infection in the community if our testing turnaround is not within 1 to 2 or 3 days.
And that's why I had asked in the chat if we could somehow find out what the percentage or the numbers of tests are from MedExpress and Walmart and Penn State versus Geisinger and Mount Nittany, the ones that are fast, right? Because then if it's 80% are 10 days or more, well, then what Amber just said is highly applicable. But
Right.
if that's only 10% and most of them are through Geisinger and Mount Nittany, then we need to know that. And so anyway, that's why I had put that in the chat.
I'll try to get some of that info. Obviously, the Penn State information is what we don't have. And I'll ask Maciek to weigh in on that with you for Monday, because he wants the actual numbers too. And I think hopefully he could answer that issue you just raised, Gretchen, with how many are we seeing, or the different types of tests, so that if we only have 25% of the tests in a quick turnaround, 1 to 3 days, like Amber said, that's really not having real-time information. So we'll try to get all that answered as best as we can for Monday, so whatever decision you make is most informed.
Great.
Thank you.
So I see Dan, Laurel, and Scott all have hands up. We have several attendees in public comment who also want to.
That's really what my hand is up for, is to maybe allow that and then come back, just so you know.
Dan or Scott, do you have a time constraint that you need to speak before public?
It'd be nice to be done. Thank you. And I just want to suggest that we follow the data. If we lower the threshold to 5, we follow the data. I think that will serve us well. And because of this, in any case, people will interpret this as an ambiguous situation. And I think to the extent that we can give people hard and fast rules that we're considering in making this decision, I think we'll be better off. And I think that any momentous decision such as closing schools would be more acceptable to the community if we could attach it to changes in the situation in which we find ourselves. Thank you.
Dan, so you're suggesting that you would not need to see an option around a 2-week window?
Yeah, I don't think that given our discussion about the timeliness of assessment and Maciek's ability to adapt to that in terms of his calculations, I don't think we necessarily have to build that in.
to be clear, I'm not necessarily saying that that's the direction I want to go, but I felt like to be able to make a decision, I need to have data on how timely our data is.
Right, exactly. Well, we have better news about that. I mean, if a greater proportion of the test results are coming back more quickly, we'll have a better representation of what's going on in the general population. We don't have to have all the data to make a decision about the population. I think there's a sufficient size sample that leads us to make a good decision, basically.
Scott?
Yeah, I may have to go, so that's why I'd like to speak real quick. You know, I'm also, you know, not in support of predefining that 2-week open. I don't care what the time frame is, 1 to 3 weeks, 2 weeks, whatever it is, and then a specific close. You know, I think we need to follow the data, as others have said. And the other thing that really gives me pause on it is, you know, we've used this term of the yo-yo, and yet if we do this, we're actually making the first cast of the yo-yo. So we're starting it already before we really need to. And could it get us ahead of the curve? I mean, we have no idea. The other argument, and I could see both sides of this conversation, and that is I could actually envision the students being the most behaved when they come back in that first 1 or 2 week period, because it's all fresh, and then they get acclimated and they get comfortable, and then, you know, things kind of go back to normal. On the other hand, I could also make the argument that they're going to be also happy to see each other, that they're going to go nuts, and that's not going to be the case. So the bottom line is we just simply don't have the data, and I place so much higher value on maximizing every day that we can possibly get the kids in front of a teacher, and I don't want to cut that out, you know, intentionally on the front end. Thanks.
Thank you. Any other board member comments? Okay. Should we go to public comment then? Okay, I see. Jenny Zurfie has had a hand up. And Jenny, if you could unmute yourself, if you could introduce yourself and where you.
Sorry, I did not mean to have my hand up.
Oh, okay.
So I apologize.
That's okay. Thank you. Deb Anderson, I see you have a hand up.
Can you hear me?
Yes, we can hear you. Thanks.
Great, thank you. I will keep this very brief because I'm already late to something. Thank you for all of your time and considering all of these things. I just wanted to ask if any consideration of the marching band is planned to be on the agenda for August 17th. It was delayed from August 10th. The marching band kids can't do anything else basically meaningful unless they're allowed to play their instruments. And I'm really having a hard time understanding how playing instruments outside, as far apart as you would like them to be, they could be 20 feet apart on that football field. And I just have a hard time believing that that is any more risky than what we're already allowing our athletes to do. And our athletes have been having meaningful practices for quite some time. And I'm really concerned that we're going to keep delaying the conversation about marching band. If you're not ready to act on the inside band playing, I totally understand that. But I think the marching band is a much lower risk being outside where they can do so much distance that it would be really great if those kids were allowed to play their instruments next week. Thank you.
Thank you. Did anyone from the administration want to respond, or should
Jean,
by email?
I can respond to that.
Thanks, Jean.
Yep. And so the athletic teams are actually working on the summer workout plan too. Their plan has not been approved yet either. The band, we are waiting on what they call the bell covers to move forward with any kind of performance outside. And so in addition, we're not sure what's going to happen with the athletic program, which would impact the band also. And so that's been deferred to the 31st. We do have something that we could share if we want to move it up on the agenda. I would defer to the board on that, but we don't have the supplies yet to have the bell covers or the masks with slits to move forward.
How about if I talk with Jean and Amber and Amy to see if we're prepared to put something on the agenda for Monday? I know the PIAA is meeting next with athletics. Obviously, depending on what happens there, we still have to run it through our safety team. And all of us know that bus travel with large groups of kids to Harrisburg, we don't have the ability to do what we're doing, even with our school day proposal. So I'm not going to make a recommendation. I'm just sharing that I don't think, in listening to the safety team, there's really any way we can be transporting student athletes. So I'll look to Jean and we'll check in with Amber and Amy and see if we can have an update for Monday. And then if Jean, I don't know if Kevin Stahl can give you a projected time frame on when those resources are projected to arrive.
Okay.
Thanks.
Thanks, Bob. Douglas Glannert. And if you would like to unmute yourself and introduce yourself and where you reside in the district. And we have about 3 minutes per person.
Thank you very much for allowing me to speak. My name is Doug Glannert. I am a Patton Township resident. I have a daughter that went through the State College Area School District school system. This daughter went through Penn State system. This daughter went through Vanderbilt system and ended up becoming a teacher. She's a teacher in a system that is giving her no representation. My question is, Monday night's meeting, this past Monday night's meeting, a board member, and it was repeated by Amber, repeated the question, will the board allow the teachers to be asked preference for in-class or online? And I did not hear that brought up today. I did not hear it brought up as an agenda possible item. Will you consider this as an agenda item? That's my question.
Thank you, Mr. Glannert. I'm not sure that I was the one who raised that. I'm not sure that I had majority support for that idea. And I don't think we've really resolved that question, including logistics of how that would occur. We do have an employee town hall this afternoon, and I'll keep in touch with the administration and rest of the board on this question. Tammy Nowacki, I see you have a hand up. If you could unmute yourself and let us know where you reside in the district.
Hi, I'm Tammy Nowacki, and my kids go to Spring Creek. And I have a couple of questions pertaining to remote. I just jotted down that for 4th grade, the average is 22. And I recall something being mentioned about having paras for 3rd through 5th grade because they normally don't. And so my first question is, will there be paras for 3rd through 5th grade? And do we have confirmation that we have enough people that are willing to do it? So that was my first question. My second question, will there be a meet the teacher for remote students, possibly an outside kind of setting? I would like that. And then the third question is, what do remote parents do if there are internet issues within the classroom? As someone who really loved the remote plan in the beginning, kind of disappointed that we're going to be together with in class. I think it's so challenging for everyone involved. So I wish there was kind of some kind of place where remote parents could go to for their questions, because they differ a lot from those in class, and where they can find support. That's it. Thank you.
Thank you, Tammy. Dr. O'Donnell, would you agree remote parents should continue to with their building principal on questions?
Yeah, I mean, obviously, if we're in school communicating with that teacher, I mean, our ratios of students to faculty are lower this coming year. There aren't a lot of students that are on each individual teacher's caseload who will be remote. So obviously, the teacher's the point of contact. We have not. I mean, our budget, and the board knows this, is significantly less. It's more challenging. So we haven't been able to move forward and say, hey, let's add pairs to grades 3-5. So we have not asked for those resources because we just don't have them to expand that amount of staffing. So, but yeah, teacher, principal, similar lines of communication if we have concerns about or questions about something. As far as having all students come in and meet with teachers, you know, we're trying to get up and running. If people selected remote, you know, that wasn't set up to have all those face-to-face meetings, but I will absolutely check in with the assistant superintendents and curriculum directors to see if at some point people can have the face-to-face, but I realize not all parents who've selected remote want that. So it's a tough one to iron all that out. But.
Okay, thank you. Laurel, you had mentioned you had a comment or question.
Yeah, thank you. I just had gone and looked at the calendar. We've been talked about this idea of a 2-week in going to remote. One other thing to maybe think about, and this is sort of, again, top of my head, but we have Labor Day off as a holiday, and whether there would be value in actually going ahead and amending our calendar to give a day that basically for troubleshooting, if there have been things that came up over the course of those first 2 weeks, and that would be a, so it's somewhere in between. And it was just a thought off the top of my head. I haven't thought it through and the ramifications, but I am worried about how, because we've talked about this idea that we're building a plane as we fly through a snowstorm, and that maybe knowing that there was a day for teachers for all of the various systems to actually be able to concentrate on troubleshooting, getting things ready to move forward. So that was that thinking. And the other issue I wanted to bring up is one that I can't remember who had brought it up previously, but what we will be doing within the building to assess how much we are actually following our safety plan. I know the intent is to do it 100%, and we also know that children sometimes rip off their masks. So I do want at some point to hear, and I think it's actually a part of that emergency template, is how we are assessing what we're doing. So those were the two things I wanted to bring up.
Well, I mean, obviously the key protocol and the masks appears to be hands down the biggest question that we receive or concerns. And, you know, I think we have a hard line on masks, and we're gonna, you know, if a student refuses to wear their mask, we're not going to permit them in a classroom, and that'll be sensitive, and we're going to have some sensitive conversations with some families, and because that means we would exclude a student. Obviously it's behavioral and we can help them change their behavior and wear the mask, great. But if it's a flat out refusal, well, those students will be welcome to be remote. But we'll be monitoring it through the principals. We'll be in the buildings. You know, absolutely, you know, the biggest protocol, the most significant with the distancing, the masks, we have to have that in place. Obviously, listening to the faculty and seeing what they're struggling with is going to be a big factor in this, because principals are going to be with their teachers, and, you know, teachers are going to go to principals with problems. And so we'll be monitoring on a day-by-day basis, and we have to stick to the plan. And then that means there's going to be some sensitive conversations that principals and assistant superintendents and myself are going to have to support and have.
Okay. Any other questions or comments from board members? Anything on future agenda planning from board members? So, of course, feel free to email anything in regard to future agendas, including for Monday. So with that, I will look for a motion to adjourn.
Buffy, so moved.
I'll second.
Okay, that's been moved and seconded. All in favor of adjourning? Aye.
Aye.
Anyone opposed? Okay, then we are adjourned.
Thanks, everybody.
Okay, thank you, everyone.